Welcome people. Currently we are in the antimicrobial chapter under pharmacology. In that we have finished the general considerations. Now we are moving on to the second part, sulfonamides, cotrimoxazole and quinolones. Under sulfonamides they have not asked any question in the university. Cotrimoxazole they have asked few questions like sequential block of folic acid, trimethoprim, okay, uses. Very important question is this one, cotrimoxazole uses. Under quinolones, the questions that they have asked so far, fluoroquinolones, ciprofloxacins, all the axons they have asked, okay. So let's dive into the first one, sulfonamide. Just a brief of exactly what it is, okay. Sulfonamide, these are the first antimicrobial agents to be discovered. Their utility currently is limited. They are only used in combination with cotrimoxazole, okay, that is trimethoprim. Fine, good. Let's move on then. So sulfonamides, what we learned so far, it is the first antimicrobial agent and it is utility currently is limited. It is used only in combination with trimethoprim, okay. Now let us move on, see the structure of sulfonamide. This is very similar to the structure of PABA. Let me try to explain it neatly to you. See, folic acid is nothing but pteridine plus PABA plus glutamic acid. Okay, and bacteria can make folic acid. However, humans, we cannot make folic acid. Many bacteria can make folic acid. To make folic acid, it needs pteridine, PABA and glutamic acid. Now, this sulfonamide is very similar to PABA. Now, this sulfonamide, what it does, it will competitively inhibit the union of PABA with pteridine. So, a defective pteridine-PABA combination is formed. Okay. Defective dihydropteroic acid is formed. So, this is the way it acts. Let us look at the sulfonamides which are of clinical interest. Sulfadiazine, sulfamethoxazole, sulfamethopyrazine, doxine. Then you have the local ones. These are the systemic ones and these are local ones. Sulfacetamide, sodium, mephenide, silver sulfadiazine, sulfasalazine. Sulfasalazine is poorly absorbed. Okay, so we have mainly some names we have learned. This is not very important because it has not been asked in the examination. Just let us go back to our previous PPT and check what we have learned about sulfonamide till now. This was our PPT. Remember, sulfonamide and related drugs in chemical classification. We saw sulfadiazine, sulfones. Mechanism of action, what does sulfonamide do? Intermediary metabolism, it will interfere, right? Let's put that here in our new PPT. So what and all we have known about sulfonamides, we'll write here. Sulfonamide, we know so far that it is going to interfere in the intermediary metabolism of the bacteria or the microorganism. Fine. What else do we know about it? It is bacteriostatic, primarily bacteriostatic, sulfonamide. We have seen combinations of sulfonamide with other bacteriostatic agents, remember? Then what else do we know about it? That's it. So these were the two things that we have learnt. primarily bacteriostatic and they interfere in the intermediary metabolism of the microorganism. So we are closing the sulfonamide video. Sulfonamide, the first antimicrobial agent's current utility is limited. You can remember sulfadiazine, an example if you want to remember. The way it works is, structure is very similar to PABA. So the bacteria can no more synthesize folic acid because the sulfonamide is going to interfere in the folic acid synthesis. This is the action, correct? This is the action that you're going to learn here. Intermediary metabolism, that is nothing but folic acid synthesis, correct? It's bacteriostatic. That's all for now. See you. Bye-bye. One more topic, cotrimoxazole is nothing but sulfamethoxazole plus trimethoprim. Okay? So, trimethoprim plus sulfamethoxazole is cotrimoxazole. Okay?